It's the one beauty treatment that many women will tell you they absolutely cannot live without. The toxin that eliminates facial wrinkles makes 40 look like 30. Just ask me. Of course, I'm talking about Botox. Time flies. This month, Botox Cosmetic turns 10 years old, officially, for what it's used in this purpose, right? Its use has expanded way beyond forehead furrows and crow's feet, although that's what most people are using it for. Joining me now to talk about the evolution of Botox Cosmetic and to demonstrate one of its newest uses, dermatologist Ava Shamban. She practices in Beverly Hills, but is, well, according to what we're saying, one of the top Botox injectors in the United States, so you must know a lot about it.
Yeah, well, I guess it's quite the title, but it's true. I have been using Botox for the last 10 years, certainly since it's been approved for cosmetic use. Botox is not only approved for the treatment of the lines that occur in between the eyebrows, the so-called frown lines, but it's also approved for sweating under the arms and for migraines and also for people who have spasm. So it turns out to have multiple uses. And so what I'm going to demonstrate on Thecla is it does a couple of things. We're going to inject into her frown line. Go ahead.
Thecla, have you ever had Botox before?
Long time ago.
Long time ago. Okay, so you haven't had it in a while, so you can tell us how painful it is. Are you scared at all?
I was a little hesitant.
Why?
But no, just because I'm here getting an injection on TV.
Live.
Yeah,
Yeah,
you're
that's what I
worried
do
about
best.
it. You know, what I hear from
yeah.
people a lot, they won't do it, and I do it. They won't do it because it's botulism, and is it going to ruin their face? And doctor, you could probably, you know,
I can
certainly
answer that. It's absolutely the safest thing that I do in my office. It's safer than getting into your car and driving to the office because there are so few side effects, and it's been used in millions of people for so many uses over so many years. It's
you go ahead and do it
safe.
so that we can. Can you talk while you're doing that?
I certainly can.
I figured you could. You know, they recently, as you do it, they recently came out with a black box warning a couple years back, you know, because Botox can travel and cause problems.
Well, it turns out that it absolutely does not travel. It has to do more with technique. And why the FDA issued that black box warning, I'm not sure at all. Because as I said, for the amount of usage it's had, there are very few problems.
Okay, go ahead.
So what you can see in Thecla is that her brow has dropped here from time and worry, perhaps. And so go ahead and pull your brows together and frown. Let's show that, ooh, she's got a little Grand Canyon there. So with the Botox...
It's not nothing. It's nothing.
It's nothing, but it's going to go away. And so with this little protein that we're going to inject into the muscle, it's going to relax these muscles that create the frown, and by relaxing these muscles, the muscles that lift her brow are going to be able to go up. So she's actually going to get what we call a chemical brow lift. So go ahead and pull your brows together. Now relax. So you can see those nasty frown lines. So here we go. One little pinch here.
All right, so I know I get that done, and it's really not very painful at all for me.
Yeah.
Thecla, don't talk yet, because you just relax as much as you can. I can see you tensing up a little bit. And when you're done, you'll talk to us about how that feels for you. Now, the thing about that line, and it's not only that line and the wrinkle, but sometimes you look too angry or whatever. But this is the one that you're doing right now that you call the brow lift.
This is a depressor muscle here. So Botox is like treating the yin and the yang of the face. So we're relaxing the depressor muscles so that the elevator muscles can lift her up. So she doesn't have this angry look, and that she can look relaxed and serene.
Right, and it takes some of that sort of tiredness and that angry, like, you know, as you start to get a little bit old, people are like, what's wrong? It's always what's wrong.
That's exactly right.
And there's nothing wrong.
There's nothing wrong. That's exactly right. And so it gives you a nice, calm perspective in which to view the world. And the other thing that's been shown is that people who frown less are actually happier.
Yeah, oh, absolutely true.
They're happier.
We have enough time. The one use I really wanted you to show, that's the use everyone's seen how many times on TV. Show us how it's used in the neck. This is where I sort of moved on to this because I started to see the age in my neck, and that's this sort of, you do this, and these really stick. What are these called?
Turkey bands.
Oh,
Those
yeah,
are
I love
turkey
that
bands.
name.
And so one thing the
name.
turkey bands do is they actually can pull your whole neck down and the side of your face. So one off-label use for Botox is to inject these bands. So tense that up again. So here, you can inject right in the belly of this muscle, and it relaxes those bands. A lot of actresses have this done, so they still have this nice, clean jawline. And it's considered to be preventative, but again, it's an off-label use.
Go ahead, start doing that. Did that hurt, by the way? Because I've got a wrap.
Not at all.
Not at all, right? Now, we don't see the results right away, and we have to let people know that, doctor.
That's right. Botox takes 7 to 10 days to work.
All right, awesome. We're going to have to get out of here as you probably put a little bit in the neck. Go ahead, tense up and do a little bit in the neck.
Really
let me tell you,
tense.
It does make a difference. And this is a secret the actresses use.
That's correct. Before they walk. That's right. Because, ooh.
Is that right?
Okay, it's just a teeny tiny bit of blood, just a little pinprick, right?
Just
but
a tiny,
yeah.
No, but I'm completely in the belly of the muscle. There's no rest or anything else.
Can you feel it? You're going to just love the way you look, girlfriend. That's all I got to tell you. Dr. Shamban, thank you so much.
Thank you.
Yeah, we really appreciate it. So how much would you say you would, you know, you always do CCs and how many? And
It's done by the number of units.
By the number of units, yeah. I never understand that. All right, you guys, thanks for coming in.
Thank you.
You just helped a whole lot of people understand.
Oh, good.